Hello and welcome to today's episode of Undergraduate Exam Ready Series by IAPSM West Bengal chapter. This has been an endeavor to enrich our students on how to take on the exams in the best possible way. And with that, today I, Professor Dr. Aditi Aikat, Secretary of IAPSM West Bengal chapter, and also the Professor and Head of Department of Community Medicine, Jagannath Gupta Institute of Medical Sciences and Hospital Central Campus, bring to you our 7th semester question paper, Decoded. Well, first and foremost, the disclaimer. Here we are not to tell you exactly the ideal answer. But what are we going to discuss? Mostly focusing on how best to approach any question. Because just as the content of the answer is important, so is the structure. Sometimes you write many pages and without any paragraph breaks, no outlines, no proper flowcharts or diagrams involved, or no underlines. Trust me, when we go through the scanned papers, it is extremely difficult to decipher your answer. So it is very important you read the question carefully, identify the commands, and follow the marks distribution. Just because you know it doesn't mean you have to write it down. So use headings, flowcharts, and diagrams wherever they improve the clarity. For case-based questions, answer from the rule and context given in the state so that it really addresses what it is supposed to. And for program or guideline-based questions, please stick to the national programs instead of just the generic textbooks. Now, let us take up the paper one. And as I discussed with you, the high approach to the semester questions. One of the first questions that I'll be taking up was from epidemiology. Define epidemiology, classify the epidemiological studies, and describe the steps of one observational study. Very basic question, very simple. But do remember, any answer needs to have the major keywords. Without these keywords, the answer loses its right mark. So, when you are defining epidemiology, the distribution, the determinants, the health-related states or events, that is for specified population and its application, has to be there. Now, coming to classification. Now, again, here I want to make a very important point, and that is please stop trying to memorize. Community medicine is not just about memorizing, data. It's more about building your concept that you are going to apply even after you pass out. So, coming to this classification of epidemiological studies, just remember the basics. If there's an intervention, it's an experimental study. If there is no intervention, it's an observational study. And in the observation, if there is no comparison group, and you are simply trying to develop a hypothesis, then it is a descriptive study where you're looking at the time, place, and person distribution. But in this observational study, if you have a comparison group and you're evaluating the hypothesis, then it no longer remains descriptive. It becomes analytical. So, in analytical, again, you have cohort, case control, and analytical cross-section. Similarly, in experimental, if there is use of randomization, it becomes an RCT, and in the absence of it, it becomes an RCT, and so forth. Now, coming to here, you see it's mentioned steps of one observational study. Try to avoid cross-sectional study. It doesn't fetch much marks. It's always better to go for case control or cohort. Whichever is having greater clarity to you, go for that. And mention the steps so that it gives a clear impression to the examiner that you are aware of the basics. If possible, add a schematic diagram. It always adds a value to the answer. Now, there was again another question that asked for latent period, the NCD risk factors, and the prevention and control of any one NCD as per the national programs. Now, here a warning. Do not confuse latent period with incubation period. Latent period is more to deal with the non-communicable diseases, and incubation period is more to do with the infectious diseases. Now, that's putting it very simply for you. Now, again, in the NCD risk factors, try to put it down into a structured manner in modifiable risk factors and non-modifiable risk factors, and accordingly list them. Now, whichever question comes with the tagline that national program according to such and such national program or relevant national program, it means you have to mention the national program based screening, treatment, follow-up, referral, and complication preventions. So do be well conversant with all the national programs related to the major diseases. Now, this one's about the disaster cycle. How will you manage as a BMOH when the block is cyclone prone? What to do before, during, and after a cyclone? Now, when you are asked to think like a BMOH, in these cases, nobody is expecting you to, describe trauma surgery. We want you to think from the public health perspective. So, in the disaster cycle, it is always desirable if put forward a diagram of the cycle that involves the mitigation, preparedness, response, and recovery. And in the before, during, and after, if possible, write in separate segments. Do not write in a complete narrative. In the before, you should focus on the risk mapping, vulnerable group identification, ensuring the supplies, shelters, facility and ambulance readiness, and a proper coordination. Now, during the period of any kind of disaster, one is to focus on triage, emergency care, referral, safe water and sanitation in case of cyclone or flood for that matter, surveillance and essential services. And after the disaster, the focus areas while writing should be on outbreak surveillance, water quality, sanitation, vector control, rehabilitation, and of course, reporting and review. Now, Another important question, which also happens to be one of the community medicine basics, which I will say, falls under the must-know areas, is the natural history and levels of prevention. Here, it was again a very generic question, but it can actually come in any form. There could be a clinical vignette given, and you may be asked to describe the prevention as per the different levels of prevention. So, coming to natural history of disease, you should categorically mention the two phases, pathogenesis and pathogenesis. And it is desirable that you provide a diagram. Map the primordial, primary, secondary, and tertiary prevention onto the natural history. And always try to give disease-specific examples. And as I have said earlier, and I reiterate again, a label diagram is far better than writing pages. It gives you answer clarity and fetches for marks. Now, there was a question on classification of dehydration and managing some dehydration in a 2-year-old 10 kg child. Here, you have to keep in mind the IMNCI directives of look, assess, feel, and then proceed towards the some dehydration management. When it is explicitly mentioned that it is some dehydration, you do not spend your time explaining the other categories of dehydration. Now, coming to some of the short notes and explain whys of paper 1. SRS. Please do remember, it is nothing to do with your sampling. Often students get confused with it. It is, this sample registration system is actually a dual record system that involves continuous enumeration and independent retrospective survey that involves matching or verification. So do not confuse with any kind of sampling in this case. Now coming to autonomy. You should be focusing on mentioning about informed consent, information, comprehension, the voluntariness, capacity of the persons, the confidentiality, and the right to withdraw. Because these are the basic tenets that involve the autonomy in research. Now, biomedical waste segregation at source. This is again a very basic question, and it has been partly taken up in episode 1. So I'll not build much, but we'll just ensure that you remember it is to ensure safer and appropriate biomedical waste treatment. Now, sensitivity and specificity are inversely proportional. Here, it would be great if, in fact, the best thing is, instead of writing a good long paragraph, to use that graph with that crossover and explain the cutoff, how it improves one at the expense of the other when that particular overlap is shifted. Now, another question that had come here was, carrier is more dangerous than cases. Well, you are all aware of the iceberg phenomenon of diseases. So carriers are silent, undetected transmissions, and it leads to menace even before we know. And now, why hepatitis B is given at birth dose? That is one of the explained whys. is basically to prevent the perinatal transmission. And regarding sanitary latrine is an ideal example of sanitation barrier. Here you have to mention the orifical route transmissions and the 5 waves. If you give the diagram as is always taught in every college, the 5Fs, it would be great. Now coming to paper 2, do remember, in case of any case-based questions, connect the clinical clue to the community medicine framework. Now, the first question in paper 2 that I'm going to discuss today is about define or classify LBW, the causes in India, prevention, and the danger signs. Do remember the cutoff value, 2,500 grams. And regarding the classification, usually that we adopt is LBW less than 2,500 grams, very low birth weight, that is less than 1,500 grams, and extremely low birth weight, that is less than 1,000 grams. Apart from this is based on the body weight. They can be based on the maturity of the newborn, and there you can have the preterm and the small for dead babies. That will add depth to your answer. And while giving the reasons or the causes, please do not write in a flowing manner one after another. Try to categorize maternal causes, obstetric causes, fetal causes, socioeconomic or environmental causes. That gives that impression that you know how to organize your thoughts and express better. Now, in case of prevention, you need to talk about the adolescent nutrition, how it is the base on which this whole thing starts. Delaying the pregnancy, ensuring spacing, proper antenatal care, management of anemia and infection, and along with it, high risk. So these are the points which you need to build upon. Regarding the danger signs, you have to mention about the APGAR score, along with the feeding difficulties, lethargy, hypothermia, difficulty to breathe, convulsions, severe jaundice, or infections. The APGAR score is about the appearance, pulse, grimace, activity, and respiration. And it is not a substitute for neonatal danger signs, but it definitely is a guide. Now, coming to another very important question that involves a hypertensive adult and is nutritional assessment. What will you recommend? And what is DASH diet? And how to ensure medication adherence in such cases. Whenever nutritional assessment is given, follow the basic principles of A, B, C, D. A, that's anthropometric measures. B, for biochemical ones. C, for the clinical history. And D, for the dietary assessment. And as you are aware, in dietary assessment, when we are going for the family adoption programs, we do the 24 hours recall method. So in this case, the recommendation will be about maintaining a healthy body weight and BMI, salt restriction to less than 5 grams per day, physical activity increasing, avoidance of tobacco in all forms, both smoking and non-smoking variants, alcohol moderation or avoidance, sleep and stress management. Now, these are, again, as I'm telling you, these are the basic tenets that you need to focus on. Coming to DASH, it is the dietary approach to stop hypertension. It emphasizes the incorporation of fruits, vegetables, whole grains, pulses, nuts, low-fat dairy, and limiting the sodium while also limiting the saturated fat and abstaining from processed foods as much as possible. So it would be good to mention the number of servings, the number of grams of sodium restricted to qualify your answer even better. Now, adherence council. Here you have to mention about identifying the barrier, explaining the asymptomatic risks, reminders and peer organizers, family support. Please remember, in case of any management, the family support is key. It makes a big difference. And also about the regular follow-up. Next, we come to the question of geriatric healthcare. The question was about estimation of geriatric health burden, common health and social problems, and the national program related to older persons. Here, regarding the common health problems and social problems, please categorize separately. In the health, you can mention the geriatric giants, which you usually talk about, incontinence, falls, fractures, along with it, the non-communicable diseases, and multimorbidity is a very common thing in this age group, along with mobility limitation, cognitive and mental health issues. Regarding the social issues, isolation, dependency, financial insecurity, neglect, abuse, and inadequate support are some of the things that you may mention. The principal health program which you must write is the National Program for Healthcare of the Elderly, or NPHCE. Now, if you add some more value-added schemes, it adds to your answer and the general impression you're making to your examiner. Like Rashtriya Vayosri Yojana, Atal Buddha Yojana, Indira Gandhi National Old Age Pension Scheme, and in fact, there are many more. Coming to the question on demography, where sources of demographic data, demographic cycle with diagrams, and population pyramid was asked for. Here, the sources are not from journals, and the sources are not from, asking. It is from the census, it is from the civil registration system, the sample registration system, the population surveys, and things like that. Now, regarding the demographic cycle, please provide a diagram and explain the birth rate, death rate, and population growth in each stage with example of a country. Regarding the population pyramid, again, I'm reiterating, do not write much, just focus on the population pyramid diagram as per age sex composition and mention the different stages. We also had a question regarding the cotton workers with respiratory symptoms, where the probable diagnosis was asked and occupational hazards with examples and prevention were also part of the question. When we mention cotton, the probable diagnosis, of course, points towards bisonosis. And the hazards, again, you should answer in a very categorical manner, grouping them under physical, chemical, biological, mechanical, psychosocial, and ergonomic. And regarding the prevention, again, categorize them as explained and link the preventive measures specifically to the occupational exposure. Do not write generic preventive measures. Now, a few short notes. Ergonomics. It is about fitting the job to the worker and the workplace design, the tools, repetitive strain and fatigue prevention. So that part is the key of this particular short notes. Now, PHAIC, it is about public health emergency of international concern. Here you are well aware about COVID, and now Ebola is also making the rounds. They are all examples of public health emergency of international concern. So please do look up this. The key idea is extraordinary event with risk of international spread that may require coordinated international response. So connect the PHAIC with international health regulations and the role of WHO. Few more extend the statements. Food additives and food adulteration are not the same. One is about for enhanced quality or appeal, and other is compromising with the purity, the quality, and the safety. So that basic has to be segregated. Now coming to HBNC, prevents neonatal death. That is home-based neonatal care because it enables early danger sign detection, ensures breastfeeding initiation, proper thermal care by kangaroo mother care, and hygiene and timely referral. So these are the basic information that should be present in your answer. Growth monitoring is important for every individual child. And nutritional surveillance is about population trends and public health action. The question is about growth monitoring and nutritional surveillance are not the same. Now, international organizations and their rules. Their rules are mostly about surveillance, coordination, standards, technical guidance, resources, and capacity building. So just remember the basics and build on that. Prioritization is very important in health planning. Well, needless to say, health needs are many and the resources limited. So there comes the story of prioritization, which considers the magnitude, the severity, the preventability and feasibility of the situation and leads to optimization of your resources. So what are the final exam takeaways? Follow the marks distribution. If it asks for 2 marks and you know a lot, don't write 5 pages. We are not going to weigh your answer script. We are certainly objectively assessing it. Use the exact framework the question asks for. If it asks for IMNCI, please go for the same. If it asks for a CISCAR national program, then follow that. Classify before you enumerate. Your flow diagram should come before, and then you should build on that. Because structured answers are always easier to evaluate. And for you, that makes good news as it fetches better marks. In explain why question, show the reasoning. Do not just define it and leave it there. Trust me, it won't get you anywhere. So know the answer, great. But structure the answer. Make it easy for the examiners also to award the marks. So it's a both-way traffic. So with that, keep revising, keep practicing, structure your answer, highlight the key points, make every mark count. All the very best for your examination, and we'll be soon back with few more episodes coming from esteemed faculties of different medical colleges. So stay tuned. And subscription doesn't cost a penny. Do subscribe, follow,